Hi everyone. In today's clip, I will talk a little bit about gallbladder and gallstones. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. A well-maintained gallbladder is critical for your digestive system to function properly. The gallbladder makes certain that bile, which is the digestive fluid secreted by the liver, is used to its full potential. So before I go on, let me do a quick intro into bile. Bile plays many vital roles. It helps digest foods by breaking down fats, oils, and other nutrients. In addition, bile helps prevent diseases by maintaining the level of friendly bacteria in the body and destroying harmful organisms. So furthermore, bile also eliminates toxins and other unwanted materials from your system by stimulating the rhythmic movements of the digestive muscles and lubricating the intestinal walls, two actions which help push waste matter out of the body. After the bile leaves the gallbladder and enters the small intestine, it helps break down fatty molecules sufficiently to allow fat and fat-soluble vitamins like A, D, E, and K to enter the bloodstream through the intestinal lining. If this bile function is impaired, you risk not getting enough nutrients from your food, leading to a variety of ailments. The gallbladder is the key to processing bile correctly so that bile can perform its various duties. Gallstones are the most common cause of gallbladder problems. They are hard rock-like formations largely made up of excess cholesterol deposits left behind by the bile in the liver, gallbladder, and the bile duct tissues. Over time, these deposits build up into biliary sludge, and if not flushed out, they turn into gallstones. Gallstones can be as small as a grain of sand or as large as a golf ball. Besides cholesterol, gallstones also contain smaller amounts of bile, pigments, lecithin, and proteins. Gallstones grow about 1/10 of an inch or 2 millimeters in diameter every year. The symptoms can start to show up within 8 to 10 years, and by that time, a small grain-sized stone can grow to an inch in diameter, about the size of a quarter. But waiting until this stage to change your eating and lifestyle habits is not a wise idea. Gallstones and kidney stones often happen actually simultaneously or together. Either kind can disrupt your liver and kidneys as well as your entire digestive system. So as I mentioned, composition of gallstones is mostly cholesterol, which is 80%, and sometimes bilirubin, which is a yellowish pigment that is produced during the normal breakdown of red blood cells. It's a key component of the bile and plays an important role in the body's waste removal process or mixed substances. The stones vary, as I mentioned, in size from grain of sand to a golf ball, and we have two different types. We have cholesterol stones, which is most common, and we have pigment stones, which is bilirubin based, and it often happens in the presence of a liver disease or some sort of blood disorder. Gallstones develop due to imbalance in bile composition or gallbladder dysfunction, such as not enough vitamin E, C, and minerals like calcium can also lead to gallstones. Excess cholesterol in bile, which causes crystallization, excess bilirubin from blood disorders or liver disease, poor gallbladder emptying, bile becomes concentrated, and the risk factors are various, from obesity to high-fat diet, rapid weight loss, diabetes, pregnancy and menopause or hormonal changes, food allergies, especially to pork, eggs, onions, dairy, corn, and peanuts, hydrochloric acid deficiency in the stomach, certain hormones, hormone medications, and a whole lot more. So diagnostic methods are ultrasound, which is the first line, 95% accuracy. Then there is endoscopic ultrasound, or EUS, for small stones, CT scan or MRI for bile duct stones, HIDA scan for gallbladder function, and it's a part of nuclear medicine imaging test, ERCP, which is diagnosis and removal of duct stones, and blood tests like liver enzyme, bilirubin, infection markers, and such. And many gallstones are silent or asymptomatic. Symptoms usually happen when stones sort of block the bile duct, and they can range from sudden or severe pain in upper right or center of your up front, abdomen, and pain radiating to your right shoulder or back, nausea, vomiting, indigestion, bloating, jaundice, which is the yellowing of skin and eyes, fever, chills. Pain often happens after fatty meals and can last from minutes to hours. So conventional treatments usually are watchful waiting. If stones are silent, no treatment is required. This can sometimes lead to biliary colic, which is a sudden, severe abdominal pain that happens when the flow of bile from the gallbladder is temporarily blocked, most often by a gallstone being lodged in the cystic duct or common bile duct. They might go for surgery, and we have laparoscopic removal, which is most common and is quick recovery, and there's open surgery for severe cases. Then they do medications, something like ursodeoxycholic acid to dissolve cholesterol stones, which can, in months to years, it can have recurrence. It can come back. Procedures like ERCP, as I mentioned, in which a flexible endoscope is sort of passed through the mouth, esophagus, and stomach into the duodenum to remove the gallstones from bile duct, and percutaneous or contact dissolution therapy, which is a solvent that is injected directly into the gallbladder, but that is rare. In orthomolecular medicine, we focus on root causes and prevention, not just removal. So something like dietary changes, such as reduced saturated fats and processed foods, increased fiber intake, vegetables, and healthy fats like omega-3s and omega-6, vitamin C to support bile acid synthesis, magnesium to improve bile flow, phosphatidylcholine or lecithin to support bile composition, milk thistle for liver support, turmeric as an anti-inflammatory, maintaining healthy weight, avoiding rapid weight loss, and we can also use gentle bile flow support and lipotropics or the nutrients to prevent recurrence. One folk remedy that has been very effective in many cases is the lemon juice and olive oil recipe. But for those who would do this, it's recommended to take the day and rest, as you may experience multiple bowel movements. For this, you will need half a cup of extra virgin olive oil, half a cup of fresh lemon juice or grapefruit juice, 4 tablespoons of food-grade Epsom salt mixed in 3 cups of water, divided into 4 doses. So now to prepare for this, eat no-fat breakfast and lunch on the day of the cleanse to allow bile to build up. At 6 p.m., drink 3/4 cup of the Epsom salt solution. At 8 p.m., drink another 3/4 cup of the Epsom salt solution. 9:45 p.m., mix the olive oil and lemon juice in a jar, shake well until it's watery. Now go get ready for bed, do all you need to do, brush your teeth, take shower, etc. And at 10 p.m., drink the mixture quickly while you're standing, then lie down on your right side with your knees drawn up to the chest for about 20 minutes. And then go to bed. Don't get up, don't go around, just go to bed, sleep. Next morning, continue Epsom salt sort of doses and expect bowel movements that may include sort of greenish, brown, or even reddish or variety of colors of pellets in your stool. You can repeat this in another 7 days if there are too many pellets being expelled. So also dark coffee makes gallbladder contractions stronger, which in some cases can help push out stones that are lodged in the bile duct. To heal your gallbladder, diet slowly and do not do any crash diets. Eat friendly and beneficial fats like omega-3 and 6, flax oil, walnuts, hemp, and quality olive oil. Increase fiber and water intake. Eat small and regular meals and fermented foods. Stay away from simple sugars, processed foods. Eat the top nutrients that keep the liver and gallbladder strong. These are lecithin, 2,400 milligrams a day, choline, 500 milligrams a day, psyllium husks, 1 to 3 tablespoons a day, but about an hour. If you're taking psyllium husks, make sure it's about an hour before or after meals, or vitamins or medications with increased sort of water intake. Real and unpasteurized honey and vitamin B's, B vitamins or B complex. Emotionally speaking, bile flow can slow down or even cease altogether when we get angry, fearful, excited, or worried. So, practice relaxation techniques such as deep breathing, stretching, and meditation to keep your emotions in check. Hope this has been helpful. Like and follow for more. Be the light.